Hey everybody, it's Dr. Kennedy here at Every Chiropractic Center, and today I'm going to do a special live talk about the perfect storm. So let's get started with why we do what we do. So our work is about what we put in and add in to your child's lives, not take away. We're here to add more health and more life to your kids, no matter their diagnosis, and to do the same for the community and the world. We're not looking to take away any symptoms. We're looking to add more expression of life. We have an entire practice full of amazing families and children of all different ages, birth to grandparents, making sure that they're taking care of their health and that they're preventing any sort of health issues down the line. And one of our mottos is that health happens by choice, not by chance. When you walk through our door, you're making a choice to improve your lives and the lives of your family members who get adjusted with you. So this quote really speaks to me. So we know what happens to people who stay in the middle of the road. They get run over. Traditional approaches to health, especially in children, aren't really working. Focusing on symptom-based care isn't really working. Taking a middle-of-the-road approach isn't really working. So should we stay in the middle of the road? If we do, we see a lot of ear infections. 95% of kids by the age of 3 have at least one ear infection. Asthma affects 1 in 10 children. ADHD affects 1 in 12 children. 1 in 9 boys. Autism affects 1 in 68 children, 1 in 32 in boys, and those numbers are climbing fast. And a lot of these happen without us noticing until it's almost too late, but it's never too late to take a natural approach to health with your child. So I want you to follow the video and notice what you notice about this video. Oops. So it says, how many passes does the team in white make? So the correct answer is 13. But did you notice the moonwalking bear in the middle of the shot? Let's rewind and check it out. And like the video says, it's really easy to miss something that you're not looking for. So being informed and looking for these symptoms in your children is really important to make sure that they're getting care early and getting care often. So our plan for today is to help you gain awareness of these issues and what may be going on in your kids, to get answers about what's going on in your kids, and to give you action steps. Number 3 is everything. That's why you're tuning in. Whoever said that knowledge is power forgot the most important part. You have to act on that knowledge in order for it to have power. So we're going to give you action steps today to help you and your children. So the 2 rules growing up: don't call kids names and don't do drugs. So we do neither at our practice. We don't focus on labels. We strive to strengthen what is going right in your kids. So we don't put kids in a box based on a specific diagnosis: ADD, ADHD, ODD, sensory processing disorder, autism, or any of the rest. Our job is to analyze and treat subluxation in your children in a pain-free and drug-free manner. And that's very important. So the perfect storm is a combination of 3 things. We call them the 3 T's, which are traumas, toxins, and thoughts. So we'll talk about physical stress or trauma. So it starts in the womb, in utero constraint. There's not a lot of movement going on. Sometimes there's not a lot of movement in the mom's pelvis for the baby to move. There's not enough room. Birth trauma, having a forceps birth, having a vacuum birth, having the cord wrapped around their neck, having a C-section, especially an emergency C-section, is hugely traumatic. And childhood falls. I mean, we see kids trip and fall all the time. All of those little bumps and bruises may seem insignificant, but add them all up and they can cause some major issues if left untreated. Kids sitting in car seats for long periods of time, baby Bjorns, bouncy seats, all of those reinforce very bad movement patterns in children. So getting them adjusted, making sure that we're addressing those traumas is key. So here are some examples of, funniest home videos. Oh my goodness, all of those kids need an adjustment. So the next T that we'll talk about is toxins. So we find toxins in our foods, preservative, pesticides, processed foods. Not great. A lot of sugar, especially bleached white sugar, is not good for us. It increases our inflammation. The bacteria, the bad bacteria that might be infecting our bodies loves to feed on sugar. Environmental chemicals are everywhere. Household cleaners, detergents. I know I did a Facebook Live about fragrance. A lot of fragrances cause a lot of irritation in our bodies, especially in children. And pharmaceuticals. A lot of people that's what side effects are. It's adverse effects to the pharmaceuticals that you're taking. So this study looked at industrial chemicals, pollutants, and pesticides in umbilical cord blood. So this was done by the Environmental Working Group, and it was published in 2005. They detected 287 chemicals in umbilical cord blood. So if you think your baby is immune to environmental or chemical toxic stress, this study shows otherwise. 180 of those 287 chemicals are known carcinogens, which means in high enough concentrations they can lead to cancer. So now that isn't to say that these were in high enough concentration in the umbilical cord blood, but a developing fetus needs a clean and safe environment to thrive. Having these chemicals in the womb can cause undue stress on the body even before birth. And now the third T, thoughts. So mental and emotional stress. So stressful, fear-based pregnancies. A lot of moms that come in here say they felt like they didn't have a lot of choices with their doctor. They felt bullied into making certain choices that the hospital wanted them to. That causes a lot of undue stress and fear. A lot of pregnant women now in this age of COVID are so scared and don't feel empowered by their healthcare options. Stressful, forced, or emergency deliveries. Those are felt by children. They're felt by the mothers, and all of that stress hormone surging around the mother also surges around the baby. Stays in the NICU, staying in an incubator if if the baby is separated from the mom for a long enough period of time, it's very traumatic for that baby. Fast-paced, high-stress life. So, living, honestly, what we call a normal life. It is a common life, but it's not normal. We're meant to rest throughout the day. We're not meant to be go, go, go 24/7. So, taking some rest, making sure that we're getting enough rest is so important, especially in pregnancy and early life. getting labeled or diagnosed, having people refer to you as this thing, having people put you in a box, having people only refer to you by your diagnosis. Bullying. Bullying is huge. It's a huge issue in children. Also, family stress, fighting, divorces, abuse, all of that together creates an extremely toxic and thought trauma environment for children. Now, usually we don't see a lot of these stressors until children enter school, but all of these start to impact the life of everyone surrounding the child. They're now, with virtually no routine and no normal, quote unquote, normal life because of the restrictions due to COVID, kids are even more stressed now and more frightened than ever before. We're seeing a lot of very stressed out kiddos in our practice. So, is this the new normal? A fear-based pregnancy, birth interventions, colic, difficulty nursing. Everything on this side of the graph, on this side of the slide, is considered normal. It is common. Antibiotics, screen time for children under 5, everything is common. It is not normal. All of the diagnoses on the right are becoming more common, but none are normal. So the left column is full of things that put unnecessary stress on the nervous system, which can contribute to diagnoses on the right. Not normal. So, as chiropractors, it is our job to help the nervous system function at its best by removing subluxations, which, as we talked about before, were caused by the 3 T's of the perfect storm: thoughts, traumas, and toxins. If the nervous system isn't working properly, our bodies can't integrate or understand all of the information that we're getting from our outside world, which can be called a sensory processing disorder. And it's not so much about the actions of your child, it's about the cause of those actions and their response to their environmental stressors. There's a lack of perception and coordination in those kids. Our job is not to give you a bigger and better band-aid for the symptoms. It's not to diagnose, label, or treat these symptoms. It's to enhance the innate ability of the nervous system to regulate the body and function at 100%. So, the recipe for a subluxation: physical stress, chemical stress, emotional stress, trauma, toxins, thoughts. So the results are the 5 Ds that we will talk about now: dyskinesia, disapparentation, dysautonomia, dyskinesis, which leaves a kid disconnected. So 100 different kids with any of these labels are going to be different. It's like chili. If we give you 100 ingredients, you're going to put them together differently than the next person, even though all of these relate to those kiddos. They all have physical stress, chemical stress, emotional stress. Each is going to affect each kid differently, and that's why we approach each kid differently. So first we'll talk about dyskinesia. So subluxation happens when a joint, especially a joint in the spine, becomes misaligned and fixated, losing its ability to go through proper range of motion. So you got a kink in your neck, you feel out of whack, that sort of thing. So it starts physical, kinetic, think movement, physical, but it does not stay physical. But in the physical is where we start making that connection, again, first to the spine, to start the body's healing process, and why we as chiropractors are having conversations about the spine and the nervous system. It goes so much beyond the spine, and it's really about the nervous system. So, right now I'll talk about C-sections. So, I know it's a little bit hard to read, but each bar represents about 20 hospitals in the United States. These are the C-section rates in the United States. So 23.9%, or where this arrow is is the goal for national C-section rates. Over half of U.S. hospitals exceed that percentage. So C-sections, having a C-section is extremely traumatic for a child. They're pulled out by their head, twisted around. It's a pretty violent process. I'm not going to show you a video of a C-section, but if you would like to see it, fair warning, they're pretty graphic, but a lot of that movement stuck patterns start at birth. This study is about birth and the spine. So it is called Incidence of Somatic Dysfunction in Healthy Newborns. So listen to those words, somatic dysfunction in healthy newborns. So somatic dysfunction means movement problems. So 99 out of 100 healthy newborns in this study had somatic dysfunction or movement problems in their spine, or as we call them, subluxations, when examined 6 hours after birth. No wonder why so many babies have problems feeding, problems sleeping, problems digesting and pooping. They're subluxated. They're not sending good information from their body to their brain. So dyskinesia, problems in movement, causes disafferentation. So there are actually 7 senses instead of just the 5. You know, we have sight, sound, smell, touch, and taste, but there's also movement, which has subcategories of proprioception and nociception, and then balance and coordination. So these are also extremely important and allow our bodies to get the information that they need. All the issues kids have look like output issues. The information from the brain isn't getting to the body correctly, output issues. But really, they're input issues, specifically movement and coordination and sensory issues. So the behavior or symptom is not the cause of the problem. The cause of the problem is dyskinesia, or the lack of the proper movement in the spine, subluxation, causing disapparentation, or improper communication between the brain and the body. If you put garbage in, you're going to get garbage out. If you have dyskinesia, you're going to get disapparentation. So, do you see how this doctor is putting pressure on the neck, specifically right here? That's C1, that's the atlas. All of the stuff that we're talking about, all of that information flow happens under this doctor's thumb and index finger. So, proprioception and the role of the spine. It's neurological stimulation from the movement of the spine. So the brain gets information about where we are in space, what our body is doing from the movement of the spine. About 60% of proprioceptive input comes from the spine. I think it says that in a little bit here. Over half of the neurons in the spinal cord are there for this specific function. So, like I said, 60% of proprioceptive input comes from the spine. A third of it, so 20% of all proprioceptive input, comes from the upper neck. And we'll talk about the importance of upper cervical spine care in a moment. But first, let's talk about how a lack of proper proprioception can cause physical symptoms or actions in children with autism and sensory processing disorders. You might have heard it called stimming. So, this is a good representation of stimming. So, she's increasing her proprioception, her proprioceptive input to her brain by doing repetitive and, jerking movements. So it's short for self-stimulatory behavior. and it's very common in children with autism. It's flapping, rocking, clapping, or patting. It's very common. It happens when kids with autism are experiencing a sensory overload. So there's too much input, and they're trying to increase their proprioception to get good information to their brain. So subluxation alters the input. So like I said, garbage in, garbage out. If you're subluxated, that information getting to your brain is not good information. So subluxation means stuck nervous system, not just stuck bones. Your body's stuck on the gas. You're in that fight or flight state. The fight or flight state in our bodies is also called the sympathetic state. So it's like having the engine of a Mustang, but the brakes of a tricycle, and your body can't slow down and go into a rest and digest state where most healing and growth occurs. So subluxation gnaws at the brakes and keeps us from getting to that rest and digest state. So when I say subluxation from now on, just think stress stuck on. It's misalignment, fixation, and stress. So subluxation causes decreased proprioception and increased nociception. So decreased movement and increased noise. Nociception is not only pain, but it's also stress on the nervous system. It's like having the TV on when you're trying to study. Your brain is trying to focus on the information that you're learning, but the TV keeps distracting you, keeping you from learning the information quickly and correctly. And it's like playing Metallica in an elevator. Nobody's going to feel good about that elevator ride, except maybe a few of you metalheads. So dysautonomia is a state of imbalance or dysfunction in the autonomic nervous system. It controls the organs, glands, and blood vessels, and all other major systems like the immune system and digestive system. So when dysautonomia happens, it's like your circuit breaker or your fuse box glitches in your body. So when your lights go out, do you check the breaker box or do you replace all your light bulbs? You check the breaker box, and that's your nervous system. So reiterating the importance of upper cervical care, we'll talk about the vagus nerve. So the vagus nerve starts up here in the brainstem and travels all throughout the rest of the body in the autonomic nervous system. So it gives and gets information from the heart, just to name a few: heart, lungs, blood vessels of the abdomen, liver, pancreas, adrenal glands, bowel, bladder. So if you're having shortness of breath, if you're having blood sugar problems, if you're having panic attacks, if you're having high blood pressure, all of those symptoms are happening out here in your body. But the cause of those symptoms could be a subluxation at C1, impacting the effectiveness of the vagus nerve and keeping you from functioning at 100%. So the vagus nerve is our brakes. You know, like I said, if you're in sympathetic overdrive, you're stuck on the gas. The vagus nerve is our brakes. So it's involved in social, emotional recognition and expression, speech, sensory regulation, calming. So all of these are impacted by autism and they have an impacted expression in children with autism. So if the vagus isn't working, you get some or all of these issues. And the next D we'll talk about is dyskinesia. So dyskinesia is probably the hardest one to explain, but I think it's my favorite. So I'll read you the definition. It's defined as a reversible physiological state consisting of unnoticed, misdirected neurophysical reactions to various agents, environmental events, bodily sensations, emotions, and thoughts, and the repercussions of those reactions throughout the organism. So dyskinesia leads to disapparentation, leads to dysautonomia, which leads to dyskinesia, which is like the symptoms caused by all the previous Ds. This is reversible, just like the rest of the Ds, but you need to fix the cause of the symptoms and not treat the symptoms themselves. So dyskinesia shows up in energy-based challenges like ADHD, sensory processing, autism spectrum, and again, it's the end results or effect or the output of the abnormal input. We have the ability to measure these outputs, which allows us to see exactly what's happening with your kid's nervous system. Let's see what this looks like. So in our office, we don't guess, we test. So we use our subluxation station or insight equipment to see what's actually going on in your child's nervous system to help them further heal. So we do 4 scans in our office. The surface EMG means electromyogram. So EMG, electromyogram, I like to say energy from the muscles to the generator. And I've heard that from a lot of amazing chiropractors. This measures how accurately the brain is receiving input from the muscles surrounding the spine. And this is the first sign of garbage in, garbage out. It shows us dyskinesia and disapparentation. The second scan we do is the thermal scan, which is a temperature scan. It shows us how well or poorly everything is working behind the scenes. So the autonomic nervous system, the automatic nervous system, shows us dysautonomia. Posture, we take a posture scan, which is our baseline, and it shows postural imbalances or any compensation patterns, and it shows us dyskinesis, or the effect of all of the other D words. And we take heart rate variability. So this is a resting heart rate taken over 3 minutes to determine how well the body's adapting to its environment, and it shows us dysautonomia. So I'm going to talk about 2 cases today. Our first is Gabriel. So Gabriel is 7 years old. He was reported to have trouble in school, emotional mood swings, trouble listening. He's constantly moving, and he was diagnosed by his MD with ADHD. So look at these scans. These are his initial scans. You can see how his nervous system was in absolute overload. He could not integrate any of his experiences, let alone any normal sensory information day to day. And then after 9 visits, so this is the EMG, this shows us how tight and how overloaded his muscular system was in his spine. And this is the thermal. So this shows us how irritated and how overdriven his nervous system was. Now look on the scans on the right. This is after 9 visits. That's 3 to 4 weeks of regular chiropractic adjustments. He went from 1,333, that was the measurement here, to 460 in 9 visits. Absolutely incredible. So next I'll talk about Matt. So Matt is a 10-year-old boy. He was diagnosed with high functioning autism, severe ADHD, and mood regulation disorder. So he has asthma and allergies. His mom said living with him was very hard. He was angry all the time. She felt that he couldn't be left alone. And Matt's family was sitting where you are. They tried everything to help him, and nothing was working. They were in the middle of that road. So here are some notes from Matt's teachers. So this one essentially said he had a lot of trouble focusing. He needed reminders. He was non-compliant, sent to detention. He had more trouble focusing, seemed to be in a daze. And then after this note was sent home, he had his first adjustment that day. After 3 adjustments, Matt was able to focus on his work, was only given 1 reminder to get his work completed, and completed all of his assignments that day. After 5 adjustments, he was able to focus and follow through and actually participate in his classes. After 6 adjustments, or 2 to 3 weeks of regular chiropractic care, he independently, no reminders, worked on his schoolwork and did what was asked of him. 0 reminders. And that's incredible. That is such amazing growth in just a short amount of time. His mom said he's more easygoing, he's laughing more, he's patient, he's focused, he's conversational, which is incredible. Conversational. His anger levels are decreased, and he's able to just be a child. So, here are the action steps. We need to decrease the 3 T's in your perfect storm kiddos. We need to increase their ability to adapt, and you need to find out if we can help. I guarantee you we can at least try, but you can only find out by coming in and getting them adjusted. So, number 1, that's going to take some at-home work to support your kiddos. So, decreasing the physical stress in their life, making sure they're using the correct posture when they're on their tablets or their computers. If they have to do online schooling, making sure that they're ergonomically correct, and we can help you with that. Number 2, increasing their ability to adapt. Getting them adjusted is a huge, huge part of this. Number 3, find out if we can help. Give us a call. And so our offer to you is $100 off the initial exam for you and your entire immediate family. So this includes an exam, the scans, and the report of findings. In order to get better, you have to make moves, and I hope to see you in our clinic soon. Thank you so much for joining me today, and if you have any questions, please feel free to call our clinic or text our clinic, give us an email, give us a shout out, send us a message on Facebook. We are here to help you and to support you in the growth and health of your child. Thank you so much.